Hello, everyone. Thank you so much for joining us. I'm Beatriz Canals, and we are talking Kids Health once again here. Today, joining me is Dr. Jose Rosa-Olivares. He is the PSA Chief of Nicholas Children's Hospital's Urgent Care Centers. Thank you so much for joining us, Doctor. Great.
Very nice meeting you.
Very happy to have you here because today we are hopefully going to be helping many parents out there to get ready for back to school season. It's crazy that this summer went by so fast.
So quickly.
But a lot of kids will be starting in a couple of weeks. Our son starts next Tuesday, which seems wild to me. But for that reason, we really want all of you to know some tips and advice that really can make this transition so much easier.
Correct.
So starting off, for selfish reasons, I'm going to ask something that as a mom I'm going through. I have a teenage son. So, and it happens with the little ones too, but he has gotten into this pattern, this sleeping pattern that teenagers go into where he goes to sleep very late and wakes up very late in the afternoon. That has to stop.
Correct.
So how can we start and when should we start getting them ready for the routine of back to school?
So we have two teenagers at home too.
So you know.
I understand you. We understand you completely. Typically for the teenager, it's always good to work on communication and making sure that you can bargain the benefits of going to sleep earlier. And you want to try to start getting back into that routine about a week or two in advance before school starts. It doesn't have to be every day, but certainly getting back into, perhaps moving up the sleep hour a little bit at a time so that he can go to sleep a little bit earlier, so that he can wake up a little bit earlier as well. And that's a good way to start transitioning so that you don't have to do it, from one day to the next.
Our son argues that he wants to wait and enjoy every minute of summer. But I know that first week will be brutal. It really does make a difference.
Yes.
And for the little ones?
So for the little ones, because it's a little bit easier to engage them into the routine, you also want to start about a week in advance and making sure that you keep track. Typically school-age children need to sleep anywhere from 9 to 11 hours every day. So you calculate that and then you make sure that you start moving up that time to go to sleep slowly every day by an hour or so until you get into that time that you want, a few days before school starts.
And we know that enough sleep is so important when it comes to being able to pay attention in class and do well in school, so it really makes a difference. Another topic that is so important for the little ones and the older kids as well is hygiene. School's starting again, the germs are out there, we want to keep them healthy. Should we start talking to them about that already?
Absolutely. So, we all know that hand washing is really the best way to prevent germs from getting into us and into others. So you want to make sure that you foster that, routine at home, hand wash all the time, wash your hands every time you use the restroom, wash your hands before you're going to eat, wash your hands every time you think your hands are dirty, and that will create that sense of responsibility to ensure that they pay attention to that particular detail.
And it'll become almost like just a habit. They'll be used to going and washing their hands.
Absolutely.
So it'll
Absolutely.
Be routine
And in school, of course, sometimes they don't have the ability to go to the bathroom and use soap and water. But the majority of schools do offer, hand sanitizer, and they can do that. They can use that as well when the hands are not visibly dirty.
So maybe parents can also keep that in mind when they're buying the school supplies, include an antibacterial that they can take with them to school, pack that in their backpacks as well. Most schools require that they have their immunizations, that kids are up to date with them and show proof of that. There's other examinations also that this is a good time for them to take their kids to get checked.
Yes, absolutely. So, the summertime is the best time to get your full checkup done, obviously for us adults and for children as well. So that's the time to speak to your doctor about growth and development, any concerns about, checking the vision, hearing. That's when you get your full physical exam and make sure that you're growing appropriately. That's the time to, look into immunizations and make sure that you have your shots, that are required. And, the state of Florida and many other states have rules and regulations that on vaccines that children need to be able to complete before they start the school year. Make sure you visit your dentist as well. So you can kind of, put it all together and take advantage of the summertime where, you might have a little bit more flexibility in your time to be able to fulfill those.
Absolutely, and it's important. You mentioned the vision. With our son, we found out that he was having difficulty seeing. I wish I'd done it in the summer. Unfortunately, we waited, and he had already gone through some trouble in school not being able to see by the time we caught on, and then it is more difficult to get an appointment and be able to take them in. So do it right before, and then
Correct. And at that time, you might receive, recommendations if you need to see a different physician or get, glasses for them. They will have the ability to get used to them before they go ahead and start school.
That's right. There is that period of time of adjustment. Another examination that's so important, and I think this is wonderful that Nicholas Children's Hospital offers this for free. EKGs, kids that are going to be participating in any sports, dance, anything that really is of great activity, right?
Yes, absolutely. So we know that in the United States, some children unfortunately do die from diseases that have not been identified, and that can certainly put them at risk, especially if they do, high-level activities. So, there are recommendations to use some screening evaluations, aside from obviously visiting your physician and getting your checkup done. Doing an electrocardiogram might be an opportunity to identify those particular young children or young adults and teenagers that might have a disease that could put them at risk of sudden cardiac death.
I know that in sharing the information that's so wonderful that Nicholas Children's Hospital does offer it for free, and you can call and make an appointment for your child. In sharing that with my Facebook friends, it's interesting to see how many parents responded by saying that they came in, brought their kids, and in some cases they do discover maybe nothing major, but there could be an issue that you can catch ahead of time before they start that activity.
Yeah, and one thing that is important for all of us parents to remember is that many times these teenagers might not have any symptoms at all. And the fact that they have been doing sports until now does not mean that they have a problem. So it's important to get the screening done so that you can identify if there is a potential problem.
And peace of mind to know that they're out on the field and they're going to be safe, or up on the stage dancing, nothing's going to happen.
And like you mentioned, sometimes you do identify other minor conditions of the heart that otherwise you will not know unless you do the test.
And something that parents, especially when they have the little ones, if it's the first time your child is ever going to school, and so many of us have gone through that, some of them don't mind at all. They show up and it's like it comes natural to them. But others, they feel a great sense of anxiety.
Yes.
That first day of school, new teacher, maybe they've never been to school, maybe even the older ones are going back, and there's that natural anxiety. What can we do to ease the pain for our kids and make it easier for us as well?
It's a combination. It's not only a stressful time for especially for the little ones, it's also for the parents as well.
Absolutely.
So you really need to think about how you want to handle that and make sure that you are able to talk in advance about the benefits on how that first day is going to look like. Make sure that your child feels supported. Make sure that the child knows who to talk to if they feel that they are afraid. Obviously, it's okay to walk in with them on the first day, but certainly keep in mind that, the longer you prolong that dependence, the more difficult it becomes to let go. So, the first day is okay. After the second or third day, it's important to have them, want to foster that independence, make sure that they, look for the rest of their friends to try to establish those relationships, and that will make you as a parent feel better knowing that he's in a safe environment and that he's reaching out to the rest of the kids to get used to this new environment that they're going through.
As a doctor, any physical signs that parents should be looking at that maybe if the child isn't very communicative, that they can tell that there may be some anxiety there?
Typically, sometimes children do have symptoms that are excessive, and certainly those that are related to, things like temper tantrums, changes in their eating habits or sleeping habits, could be, soft signs that there is something else going on. Communication is so important. So you want to make sure that you sit down with them and you ask about, how did the day go? Did they meet any new friends? Speak to the teachers. Nowadays, we all have, a way to get in touch with teachers electronically. So don't be afraid to send an email and make sure that you get some feedback back from the teachers as well. If at any point you feel that, the behavior of your child is changing, that will certainly be the time to reach out to your physician for additional advice.
Wonderful. Any other advice you have for parents out there? We're all in it together. How they can make the transition easy.
Yeah, be patient, but also make it fun. The summer was, a fun time, and school could be fun in a different way. Obviously, as you foster that discipline and getting back into the routine, also keep in mind that, they're all children. We're all, and we all went through that stage as well. So allow yourself to have a little bit of flexibility as well as you move into, structuring how the days will look, and everything will be fine.
Thank you so much, Doctor.
You're
That was
welcome.
wonderful. Great advice. Hopefully all of you out there, parents and kids alike, will have a wonderful back to school, safe, healthy, and happy.
Perfect.
Thank you for joining us. We'll see you next time on Talkin Kids Health. I'm Beatriz Canals. Muchas gracias. Thank you so much. A lot of advice out there for parents.